this HIV/AIDS in community medicine, and health education is very, very important to control HIV/AIDS because it is related to behavior and habits of people. And in community medicine, by giving health education, we can create awareness among the people and try to bring changes in the attitude of the people, okay, behavior and attitude of the people. So for that reason, HIV/AIDS is you know um, community medicine has a vital role in controlling HIV/AIDS. So this is not so much important to you, but if you see the world scenario, which was published in 2020 recently by World Health Organization, so many people are dying, and then so many people are living with HIV/AIDS. Okay, so it's a global public health issue. It's not only present in Nepal, India, Pakistan, but throughout the world it is present, and throughout the world people are living with HIV, and many people have lost their life due to this disease. And they say that 32 millions, it has claimed more than 32 millions lives so far. So 32 millions people have been affected with this HIV. And if you see, there were approximately 37.9 people living with HIV at the end of 2018. So 37 million people, they are living, with this HIV. So you know that we cannot cure the disease. We don't have any vaccines related to it. But if the disease is diagnosed on time, if they are given the antiretroviral drug therapies and treated the opportunistic infections on time, then it is quite manageable. It is a manageable chronic health condition, and enabling people living with HIV to lead. And if we give effective treatment, then we can actually increase the lifespan of the person and make improve the quality of the life of HIV patients. Okay, so in 2018, 62% of adults and 54% of children living with HIV in low and middle income countries. So mostly, and people living in low and middle income countries. So 62% of adults and 54% of the children, they are receiving lifelong antiretroviral therapy. Just imagine the burden of disease throughout the world. Not only adults, but 54% out of total population of people living in the low and middle income countries, 54% of children out of those 100% of the population are getting this treatment against HIV/AIDS. And a great majority, that is 82% of pregnant and breastfeeding women, are living with HIV, and they are also receiving ART. So not only adults and children, it has equally affected the pregnant women and who are breastfeeding, and they are also receiving 82%. That's why lots of in ANC clinics, in mother and child health clinics, this service has started off, screening people, screening pregnant women, screening women who are breastfeeding a child. We screen them for HIV/AIDS because of this cause, because of this reason, because 82% of pregnant women are suffering of and living with HIV/AIDS. And due to gaps in HIV services, so see, HIV services is very good in Kathmandu, okay, in the Kathmandu Valley, in the urban areas. But if you go to remote areas, the condition, the roads are not good, transportation is not available. So even the health posts, primary healthcare centers which are available there, trained people might not be there. If health personnel are there, ARTs may be out of stock. So there's various reasons. So due to these gaps in HIV services, 770,000 people died from HIV-related causes in 2018, and 1.7 million people were newly infected. So this is not only the scenario in the rural areas in Nepal, but in other developing countries as well, especially in a rural setup, countryside. This healthcare centers are not, it's not even accessible at times. And if health posts or healthcare centers are present also, they lack drugs, they lack medical personals. So this is a problem which is present throughout the world, especially in the developing countries. Again, I'm not talking about the developed countries. Developed countries, they have good health services. And if you see, over two-thirds of all people living with HIV live in the WHO African region. So most of the people, over two-thirds of all people who are living with HIV, they are living in the WHO African region. So if you see the videos of African region, they are, the children are suffering from malnutrition. The poverty is very much prevalent out there, and there are various diseases like HIV, AIDS, malaria, filariasis. They are very, very common out there. It's a humid, hot, tropical country, and most of the people, they are very, very poor. Their living condition is not good. Their socio-economic condition is not good. So in case of HIV, it's also most of the people who are suffering with this disease is living in African region. So between 2000 and 2018, if you see, the good news is that the infection has fallen by 37%, and HIV-related deaths fell by 45%. So, however, in fifth semester, I'll be telling you about the national programs which are carried out in Nepal to control HIV. So this is a public health issue, and how Nepal government is running specific national programs to control this disease. This type of national programs are conducted in all the parts of the world. Okay, so because of those effective national programs, we are able to decrease the number of people living with HIV. Let's say people getting infected with HIV/AIDS and people dying with this disease. So we are being able to achieve that. But however, we have a long way to go, and we are still working on that. Okay, so this global scenario, to give you the picture, like it's still prevalent throughout the world, and still millions of people are living with HIV, and millions of people are dying because of that. And not only adults, but children are also suffering because of this disease, and pregnant women are also equally affected. So this is the information that I wanted to give it to you. So now let's talk about this classification of epidemic states. So what is epidemic? Any unusual occurrence of disease in a particular area, or or more than one area. Okay, so it's epidemic. So pandemic means throughout the world it is called pandemic. Epidemic in certain localized area. Okay, um, then it calls epidemic. So there are three types of epidemics, which is defined by WHO and UNAIDS. Okay, so it is divided into low level, concentrated, and generalized. So low level epidemic means HIV prevalence has not consistently exceeded 5% in any defined subpopulation. So now here what you have to understand is, the meaning of prevalence. Old and new old existing cases together. Old and new cases, when combined we count the number, it is called prevalence. Okay, so prevalence low level is called when HIV prevalence has not consistently exceeded 5% in any defined subpopulation. So subpopulation means person who are at high risk, who are vulnerable to HIV/AIDS, like people who inject drugs, migrant people, female sex workers, their clients, male sexual workers, men having sex with men. Okay, they are the high risk groups or subpopulation. So HIV is present in the country, but if you see, it is not present. It is less than 5% in any subpopulations. Okay, so that is low level. And concentrated means HIV prevalence consistently over 5% in at least one defined subpopulation, but below 1% in pregnant women in urban areas. So these are the proxy definitions, okay, which is been used to define what is low level epidemic, concentrated epidemic, and generalized epidemic, because it's very difficult. We need some measures, we need some parameters to measure these diseases, and that's why we have used this parameters, let's say. So in concentrated, it has spread in the country, but it is more than, and when you see, it is prevalence is more than 5% in at least population. Say in female sex worker is more than 5% out of total population of female sex worker. 6% of them are suffering with HIV. So that is concentrated. But below 1% in pregnant women in urban areas. But when we see among the pregnant women, the percentage is prevalence is less than 1, but it is more than 5% in any defined subpopulation. So that is concentrated. And generalized, when it is called generalized, when it has affected all the population in the country, okay, that is called generalized. HIV prevalence consistently over 1% in pregnant women nationwide. So generalized means it is there, it has affected all the population in the country. But how we are going to define it? If HIV prevalence is consistently over 1% in pregnant women nationwide. So if pregnant women, they are not high risk groups, okay, they are not high risk groups, but if HIV prevalence is more than 1% in total pregnant women in a nation, then we have to understand that this has turned into generalized epidemic. So these are the three epidemic types that has been defined by WHO. So what's the scenario in Nepal? What type of epidemic exists in Nepal? So from starting, I mean, it started from low-level epidemic in Nepal, and over the period of time, it has evolved as concentrated epidemic. So now, the type of epidemic that we are having in Nepal is concentrated epidemic. That is, it has HIV prevalence is more than 5% in any sub-defined population. So don't get confused with this terminology, sub-defined population, subpopulation and this key affected population. If you see the national data, you don't use this subpopulation term. Okay, subpopulation term I have taken from the Park textbook. Now, key affected population and subpopulation, they are same. Okay, don't get confused with that. They are highly risk groups. Okay, I mean they come under highly at high risk group. Okay, so what are the key affected population? I told you, people who inject drugs. So people who inhale drugs, cocaine, if they inhale, they do not come under high risk groups. But if they inject drugs, okay, what happens? They share these drugs. I mean, inject syringes. Okay, so while sharing this contaminated syringes, they get this disease. Okay, this disease is transmitted from one person to another person. So you have to remember, people who inject drug and men who have sex with men and transgender people, and female sex workers. So transgender people, I think you are familiar with these terms. Okay, I mean they are born with one particular gender, but then they think that if a person is born biologically as a son, but later on they feel that that he is female. Okay, so that is transgender people. Okay, so key populations are group who are at increased risk of HIV, irrespective of epidemic type or local context. So I told you the people, who are actually exposed to the transmission of diseases, okay, are key populations groups, and they are at high risk. And they include, so I've already told you, the men who have sex with men, people who inject drugs, people in prisons and other closed settings, and sex workers and their clients, and transgender people. They are the high risk groups, okay, key populations. And the epidemic is largely driven by a sexual transmission. So in Nepal, there are various modes of transmission of this disease, but sexual transmission is the major route that is found in Nepal, which constitute 73% of the total new HIV infection. So more than 73% of the people actually acquired HIV through sexual transmission. Okay. So now let's move on to the epidemiological features. So epidemiological features means, just remember the epidemiological triad: agent, host, and disease. Okay. So first of all, you have to understand who are the agents, okay, and what are the agent factors that actually helps us to spread the disease. So that HIV disease is caused by human immunodeficiency virus. Okay, so and the disease infection caused by HIV is known as HIV infection. Okay, so human immunodeficiency virus is the one which causes HIV infection. It is also known as retroviruses. That's why the drugs used against them are known as antiretrovirals. viral drugs. It's not viral antiviral drug, antiretroviral drugs, because we are giving the drug against retroviruses. And what does it do? Retroviruses, they love our T4 helper cells and they attack them and they destroy human T4 helper cells or CD4 cells. So these T4 helper cells are a type of white blood cells. So what does the white blood cell do? It actually helps us to maintain our immune system. Okay, because there are many number and it should be more than 950 cells. Okay, per how much per liter of blood. Okay, so see, there should be more than 5 cells, 94, 95 cells. But due to this viruses, they actually go in, enters our system, the circulation system, and attacks this human T4 helper cells or CD4 cells. These are the names given to the white blood. These are the type of human cells. You can either call it human T4 cell, helper cell or CD4 cells. It's same. It destroys these cells, and once these cells are destroyed, their number decreases. And what happens once this number decreases? Our immune system also becomes poor. It also becomes weak. Okay, and we further get affected with other opportunistic infections. See, if you are strong, if your immune system is very, very good, you will not acquire COVID-19. So let's remember that, understand that way. COVID-19 is very, very, I mean, we are we are living in this pandemic of COVID-19. So HIV, once it was also it has not caused pandemic yet, but it was epidemic. So people were so scared of it, they didn't know how to protect oneself from that. So similarly, COVID-19 also, what happens if our immune system is good, then we will not be affected with COVID-19. But once our immune system weakens because of HIV, now we can easily, get infected with COVID-19 or tuberculosis or, various fungal infections, various carcinomas. So this carcinoma, COVID-19, tuberculosis, they are opportunistic infections. Okay, so remember that way. And there are two types of HIV viruses, 1 and 2, and reservoir of HIV infection are cases and carriers. So the person who has active cases of HIV, who are actually symptomatic, they are, and carriers, they are carrying the HIV virus in their body, but they are asymptomatic. Okay, they are living a healthy life. They are not showing any signs and symptoms. So these are the two reservoirs of infection. And once the virus enters our body, it will not leave our body. They are very faithful. They will remain in the body lifelong. Okay, so it can be easily killed by applying heat or inactivated by ether, acetone, ethanol. But relatively, they are resistant to ionizing radiation and UV light. But what happens once it's enter our body? We cannot heat them. We cannot inactivate by ether, acetone. Okay, so it's outside our body. We can kill them by applying heat and ether and acetone and all. So you have to remember that this HIV infection is highly preventable and manageable, but it's not curable. So there is a slight difference between HIV infection and AIDS. Whenever we write HIV/AIDS, but HIV infection is, it can be manageable, and it can be managed by giving ART and other health education. But once it reaches the last stage, that is AIDS. Okay, now AIDS is used only to denote the last stage of the HIV infection. Okay, before that we call it HIV infection. Okay, so it is not curable, and we are not able to scientists, they are still working on the vaccine, and still it's not available in the market. So we don't have the vaccine against it yet. You just remember, don't write give vaccine against HIV in the exam. So what are the host factors? We human beings are the host, and people especially who are sexually active, who are between the age group 20 to 49 years, they are mostly affected. Okay, the high risk groups I have already mentioned. Some other high risk groups are male homosexuals and bisexuals. So these terminologies are homosexuals means having being attracted to same sex people, okay, and bisexual to both the sex, girl and female. And heterosexual means getting attracted to opposite sex. Okay, so they all comes under high risk groups. Intravenous drug abuse, I've already told you, and transfusion recipients of blood and blood or blood products. Like if you don't screen the blood, if you don't screen the plasma, and just infuse them, so it might get transmitted through the blood or blood products. That's why before transfusing the blood, we always screen the blood for HIV and other diseases. That is done routinely these days. Okay, previously might be they didn't used to do that, and because of the transfusion of blood, this is used to get transmitted to other healthy people. So hemophiliacs and clients of sexual workers. So hemophiliacs is the bleeding disorder, and what happens in this bleeding disorder? There is deficiency of protein factors 8, 9, and 11, and once the person get slight bleeding also or cut, also the bleeding doesn't stop. Okay, and for this they also comes on the high risk groups. And migrant workers. Migrant worker means people, like if you for example, person living in Kathmandu goes to Saudi Arabia or other parts of the country for working purpose, then they becomes migrant workers. And similarly, some other people coming to Kathmandu for the work purpose, they are the migrant workers. Why they are high comes under high risk groups? Because and especially truck drivers. Truck drivers, they also comes under high risk groups because they live alone and may get involved in various this kind of behavior. Okay, so and that's why they also comes under high risk groups. So talking about the incubation period, so I hope you know the meaning of incubation period. The time when the virus enters the body till the time when the person develops signs and symptoms, that is called incubation period. It's a time taken by the virus to actually go inside the body and start damaging the person, and the person develops signs and symptoms. That is incubation period. So it ranges from few months to 10 years or even more. This is the reason why people who actually harbor virus, they manage to lead a healthy life for few months or for years, for 10 years or 15 to 20 years. Then after that only they might develop some signs and symptoms, and they will land up in the hospital. Okay, before that they'll be moving around, they'll be healthy, they'll be working, they will not feel any kind of illness. Okay, so what is AIDS? So acquired immunodeficiency syndrome is the full form of AIDS, and it's a fatal illness caused by HIV. So disease limits the body's ability to fight infection due to markedly reduced helper T cell. So till HIV infection, HIV affects the helper T cells, but at the last stage, what happens? It reduces the helper T cells markedly. It becomes less than 200. Okay, where in healthy person it should be more than 94, 95, but in AIDS it becomes less than 200. Okay, and patients have a very weak immune system. So once the immune system is weakened, defense mechanism also becomes very, very poor, and patients predisposed to multiple opportunistic infections and malignancies leading to death. Okay, and persons with positive HIV serology who have ever had a CD4 lymphocyte count. So T4 cells, T helper cells and CD4 lymphocyte count will be below 200 cells per microliter. Okay, I said liter only. Okay, so it should be in healthy person it should be more or equal to 95 cells per microliter of blood, not liter, microliter. Okay, I got confused. So in AIDS patients, CD4 lymphocyte count, if you do blood test, we'll find that CD4 lymphocyte count is less than 200 cells per microliter, or we can also find out the CD4 lymphocyte percentage, and it will be more than 14%. Okay, then we say this person is suffering from AIDS. It's person is not anymore suffering from HIV infection, but the person has reached the stage AIDS. So what are the different modes of HIV or AIDS transmission? So you are living in such era where you have all the internet access. I mean, have you have access to internet, Wi-Fi, and you can get all the information easily, using Google and YouTube. So I'm sure you are familiar with these things, like what are the different modes of HIV transmission. So first one is through bodily fluids, which are blood products like whole blood cells, platelets, plasma. Okay, so through that it can easily get transmitted. So they say that 95% chances of contracting HIV infection through blood transfusion. If the blood, the donor is suffering from HIV and he donates the blood, and if that blood is transfused to other needy, healthy person, then there are 95 chances is there that that person, healthy person, will acquire the HIV infection. So it's very, very dangerous. And semen, vaginal fluids are also equally responsible. That disease can be transmitted through them also. And intravenous drug abuse, I've already told you, through sharing needles. If mostly what happens, drug addicts, they share needles, they share syringes. Okay, and because of that, due to the contamination of the needles, they might contract HIV. And unsterilized plates also can be um, can transmit the disease. So through sexual intercourse, unprotected in sexual intercourse is a major route of transmission in Nepal. And in other parts of the country, oral, and anal, and vaginal equally important route of transmission. And fourth one is mother to child transmission. So why we are so much interested in pregnant women? Because if the pregnant woman is suffering from HIV, she can easily transmit that infection to her baby. Okay, and it can be transmitted through during pregnancy, during delivery time, and during breastfeeding. Through milk also it can be transmitted. Okay, and during delivery also, when the ruptures members are ruptured, mother's blood comes in contact with the baby during the childbirth. Okay, and during pregnancy also. So vertical transmission is available. It can easily cross the placental barrier. Okay, so individuals cannot become infected through ordinary day-to-day contact, such as kissing, hugging, shaking hands, or sharing personal objects, food, or water. See, kissing, 1 to 2% infection can be acquired, can be spread through saliva. Okay, they say. So better, here they say that through kissing is not transmitted. It is true, but to protect ourselves, that I think that can also be omitted. But yes, of course, why these things are, I put these things because we there's still social stigma is attached to HIV/AIDS. So if we see someone in our neighborhood who is suffering from HIV, we try to maintain distance from them. We try not to invite them in our family function, social function. So it should not be done, because it is not spread by simply hugging, shaking hands, or sharing, even by sharing personal objects. It has to enter our body through bodily fluids or blood products. Okay, and through the injections, through the needles, or by sharing food or water. It will not be transmitted. Okay, so this is not required for you. PMTCT, I'll be talking about this in the fifth semester. Now let's talk about the clinical manifestation. So how does the patient, present in OPD with HIV infection? First, the person may have developed initial infection. So in initial infection, what happens? The person is asymptomatic for the first 5 years or so. Okay, or it could be more than 5 years. We don't know the exact time, like till when the person remains healthy, asymptomatic. Okay, it could be 10, 20 years also. So now the person is, the virus has entered the person's body, but that person is still asymptomatic, and about 70% develops a generally mild illness like fever, sore throat, and rash. So what happens during this asymptomatic phase? Around 70% of the people, they present with, they will not present, they might not present, but they develop this mild illness like fever, sore throat, and rash. And They will not think that it is because of HIV. It's because fever, sore throat, it could be tonsillitis, pharyngitis, okay, and rash, and they will not pay that much attention to it. So look, they look perfectly healthy and feel well, although they can transmit the virus to others from the very beginning. There's one another fact that you have to remember, that once the person um, it's suffering from HIV infection, though the person is asymptomatic, the person can easily transmit the virus to other person from the very beginning. Okay, and HIV antibodies. So HIV virus enters our body. Now our white blood cells, they become very active. Okay, unfortunately, HIV virus affects the white blood cells inside our body. But what happens in an initial phase when HIV virus enters our body, our mechanism, this defense mechanism starts developing antibodies against them, and it takes 2 to 12 weeks to appear to antibodies to appear in the bloodstream, and 12 weeks means 3 months. So maximum 3 months it takes. Okay, so this time period, from the time the virus enters our body till our body produces antibodies against HIV, it is known as window period. So window period is usually of 3 months. So because of this reason, when the person, high risk group, um, I mean person who falls under high risk group, or who are exposed to the HIV virus recently, if they come to you and you ask them to do the blood test and it turns out to be negative, then you can't be relieved and just stay like that. You have to ask that person to do the blood screening after 3 months, because the person might be in the window period. Okay, so you have to repeat the blood test again after 3 months. Then only you can be assured that the person is HIV free or not. So during this period, although the person is infectious due to high concentration of virus in the blood, he or she will test negative on the standard antibody blood test. So during this 3 months of period, initial 3 months, if you ask the person to do the blood screening test, or standard antibody blood test, he or she will will test negative. Okay, so a second stage is asymptomatic carrier state, where the infected people, they have antibodies, okay, produced inside their body. So when you do the blood test, it will be shown. Okay, but the person will not show any signs of disease except persistent generalized lymphadenopathy, more than 1 centimeter increase in the lymph nodes will be there. Generalized cervical lymph nodes will be enlarged, lymph nodes and the groin, axillary lymph nodes, everywhere it will be enlarged. Generalized lymphadenopathy will be there. That will be the only signs present in the person, and beside that, no other signs will be seen. And duration is not clear. Average 10 years. So this carrier state will um, will occur for average 10 years. Okay, it could be less or it could be more than that also. Then the third stage is AIDS or AIDS related complex. So what happens here is, this is in a person, the person is gradually moving from the initial infection phase to the third phase. Okay, because now what happened, if the person comes in this stage to doctor, then the we can detect the disease. But what happens, since the person do not have other signs, the person may land up to the doctor in this stage only, in the third stage only. Okay, if you don't do the screening of the high risk groups, then they will come to us in this stage only. So in this stage, what happens, the person will exhibit one or more of the following clinical signs: unexplained diarrhea lasting longer than a month, fatigue or malaise, loss of more than 10% body weight. So then, losing more than 10% body weight within 6 months is very, very significant. Okay, and fever and night sweats will be there, or milder opportunistic infection. So OI stands for opportunistic infection. I told you, why they are called opportunistic infection, because they are waiting in the environment to HIV virus to decrease the virus concentration. Okay, so they are opportunistic infections, and such as oral thrush, generalized lymphadenopathy or enlarged spleen. So these are the milder OIs. Okay, so person present with one or more of the following clinical signs. There will be unexplained diarrhea lasting longer than a month. So if you happen to meet someone suffering from HIV in this stage, that person will be very lean and thin, because the person will lose weight and the person will say that I'm having diarrhea since past 1 month or so. So just think that it could be because of HIV, okay? And the person will also present with mild OIs. So now, last stage, what happens? AIDS is the end stage of HIV infection. So, opportunistic infections commonly occur at this stage, and or cancers will be present. Death is due to uncontrolled or untreatable infection. So, what happened when the person is having fungal infection? But person is the same person is suffering from other bacterial infection, and beside this, the person is also person also develop cancers. So there are multiple diseases will start attacking a person, and because of this uncontrolled, untreatable infection, the person usually dies at the AIDS in this last stage. Okay, and person not died directly because of HIV virus, but person died because of this various severe opportunistic infections, which will be out of control. Okay, and because the white blood cells, T4 cells will be very very low, our body, the person suffering from HIV will not be able to fight against this disease. Okay, and TB and Kaposi sarcoma are usually seen relatively early. So tuberculosis and Kaposi sarcoma are the infection which are usually seen at the early stage of AIDS. So this is Kaposi's lesions. This is purplish or dark brown, brown discolored patches are seen over the skin or under the mucous membrane. Okay, this is the cancer sarcoma. So opportunistic infections associated with AIDS. So see, CD4 count is very very is a marker to assess the stage in which stage the person is. Okay, so if the CD4 count is less than 500 per microliter, the opportunistic infection which may affect the person are bacterial infections, tuberculosis, herpes simplex, herpes zoster, vaginal candidiasis, hairy leukoplakia, and Kaposi sarcoma. And CD4 count less than 200, okay, in some person, then the person might acquire pneumocystic carini. So the pneumonia caused in the HIV/AIDS patient is known as pneumocystic carini pneumonia. Okay, and toxoplasmosis, cryptococcosis, and various fungal infection and non-Hodgkin's lymphoma. But if CD4 count further decreases to less than 50, okay, then the person will acquire severe OIs like disseminated mycobacterium avium complex infection, histoplasmosis, cytomegalovirus retinitis, central nervous system lymphoma, HIV dementia, progressive multifocal encephalopathy. So dementia, encephalopathy. So the person will become comatose and may become stupor at the end, at the very last days. Okay. So these diseases I will not try to explain one by one. Some definitions are given in the part. Other, eventually in other chapters in medicine and other chapter, they will be taught to you, because this is a very long chapter. So let's talk about the diagnosis of AIDS. How you can diagnose AIDS? First, by clinical signs and symptoms, by doing asking the history. Second one is by WHO clinical staging. So WHO, World Health Organization, has divided the HIV AIDS and HIV infection and AIDS into 4 clinical stages, and through laboratory findings. So clinical findings, WHO has defined the case for AIDS surveillance. So this definition is basically for AIDS surveillance. If you want to, so for measles also they have given the case definition, and for polio, paralytic polio also they have given the case definition. Why these case definitions are given by WHO? Because in rural remote areas, in the absence of the proper lab test, we can just use this definition to find out the AIDS cases. in such areas. Okay, so this is very very important for from epidemiological point of view, and especially in the remote areas. Okay, so WHO case definition for AIDS surveillance in an adult or adolescent more than 12 years is if at least two major signs with one minor sign is present. Okay, so major signs and minor signs are given. So if the adult who are more than 12 years of age, if in that person there are two major signs out of three and one minor signs out of these is present, then the person is suffering from AIDS. Okay, so what are the major signs? Weight loss equals to more than 10% of body weight, chronic diarrhea for more than 1 month, prolonged fever for more than 1 month. Okay, so these three finding signs are known as HIV wasting syndrome. Okay, HIV wasting syndrome, where there is weight loss more than 10%, and diarrhea and fever lasting more than 1 month. Okay, and minor signs: persistent cough for more than 1 month, generalized pruritic dermatitis, history of herpes zoster, oropharyngeal candidiasis, chronic progressive or disseminated herpes simplex infection, or generalized lymphadenopathy. So in children also, in children everything is same. Only difference is the child should have two major signs and two minor signs. Okay. And but here you have to make sure that they don't have any other known cause of immunosuppression, like they are not suffering from any cancer, or they are not on the any steroid drug medication. Okay. So there's a table given in the book where they have shown the clinical staging. So this is clinical through clinical findings, and second one is by WHO clinical staging. So in for adults and adolescents, how they have defined is, in clinical stage 1 the person becomes, so the clinical manifestations that I have shown you, just remember this. Okay, this somewhat, if you remember this, you can easily correlate with this. In clinical stage 1, like in case of initial infection, the person will be asymptomatic. The only sign present will be persistent generalized lymphadenopathy. That is when we say the person is in HIV clinical stage 1. Okay, and clinical stage 2, when there is moderate unexplained weight loss, but the weight loss is less than 10% of the total body weight. Okay, if it is more than 10%, then immediately you have to think that the person has entered the clinical stage 3. Okay, and in clinical stage 2, the person will have milder opportunistic infections like tonsillitis, sinusitis, otitis media, pharyngitis, herpes zoster, angular cheilitis, recurrent oral ulceration, pruritic eruptions, seborrheic dermatitis, fungal infections. Then clinical stage 2. Clinical stage 3, the person will present with HIV wasting syndrome, unexplained severe weight loss more than 10%, unexplained chronic diarrhea for more than 1 month, unexplained persistent fever for more than 1 month, and then persistent oral candidiasis, hairy leukoplakia. Oral hairy leukoplakia means at the both sides of the tongue there will be white plaque. Okay, plaque will be there, and severe bacterial infections will be there. Okay, meningitis, bacteremia, empyema, acute necrotizing ulcerative stomatitis, gingivitis, periodontitis. See, it also affects the gingiva, and the you'll have all the oral infections, unexplained anemia, neutropenia, or chronic thrombocytopenia. That is stage 3. Now, what happens? How the person presents in clinical stage 4? HIV wasting syndrome will be there, weight loss more than 10%, fever and diarrhea lasting for more than 1 month. Then recurrent severe bacterial pneumonia, chronic herpes simplex infection, esophageal candidiasis. No, now it will not affect only the oral. It will enter and reach up to esophageal. And extrapulmonary TB. Here, in stage 3, there will be pulmonary TB will be there. Okay. But if the person presents with extrapulmonary TB, think that the person is in clinical stage 4, HIV, encephalopathies, central nervous system toxicity, all the severe OIs will be seen in clinical stage 4. Why I'm emphasizing on these symptoms, because signs and symptoms, because I'll be giving the PBQ on this, and you have to remember these key points to write down the diagnosis, whether the person is in HIV infection 1, 2, 3 stage, or the person is in the clinical stage 4. Okay, that's why. So similarly for children also they are given. It's quite similar. You just go through it. Okay, I'll not go through it. You can easily read it, and if you want to know what are the exact meaning of these things, you can just Google it at for now. Okay, so let's talk about the laboratory findings. I mean, laboratory diagnosis. What are the lab tests which are available to diagnose HIV? I'm sure in microbiology they have discussed about this test in detail. So briefly, you have to remember this test name. So first one is ELISA test. ELISA stands for HIV enzyme linked immunosorbent assay. It's the best screening test for HIV, whereas the sensitivity is more than 99.9%. Only 0.1% is not there, but 99.9% we can find out the true positive cases. Okay, and Western blot is the conformity test. Once the person, after doing ELISA, the person shows positive, then you have to send for the Western blot test to confirm the disease. And specificity, that to the ability of the test to find the false test, true negative cases, 99.9%. So it's very very um, effective test. Okay, they are. And HIV rapid antibody test can be done. Okay, this is screening test for HIV. Absolute CD4 lymphocyte count, this is the predictor of HIV progression. So by finding out the number of CD4 lymphocyte count, we can assess whether the person is in clinical stage 1, 2, 3, or 4. Okay, so it's a predictor of HIV progression. And HIV viral load test, it's a better test for diagnosis of acute HIV infection. If the viral load is very very high, then the person is an acute in HIV infection. So accordingly, and once the person starts taking this highly active antiretroviral therapy, antiretroviral drug therapies, this viral load will be suppressed. Okay, so to know whether the medicine is effective or not, also this is done. And this CD4 count is very very important. And during each follow-up, we ask the person to HIV person to do CD4 lymphocyte to find out whether the person's CD4 count is increasing or not, or whether it has decreased, and whether the drug which we are giving them is effective or not. Okay, and CBC, complete blood count, is very very important, because the person might develop anemia, neutropenia, okay, thrombocytopenia. These are called pancytopenia. So we have to make sure that the person is not having any kind of this disorder. Then B2 microglobulin test, which is it's a cell surface protein indicative of macrophage monocyte stimulation. So level more than 3.5 milligram per deciliter means rapid progression of disease. So it should be less than that. Okay, it should not be more than 3.5. And P24 antigen test indicates active HIV replication. So if there is active HIV replication, then the disease is progressing. Okay, it is increasing. Okay, so now let's talk quickly about the control of AIDS. So how can you control HIV/AIDS? You know that there's no vaccine against HIV is available till now, till today's date, but it's under trial. So they are working on it. It's called RV144. Okay, if you want to Google it. You get to know all the information regarding it. Okay, so and now let's till we this vaccine is available in the market, we have to focus on the preventive measures. So first is we have to create the awareness among the people regarding this disease, like how we can protect ourselves from this disease by giving health education on it. Like we should tell them to avoid indiscriminate sex. You should have one faithful partner. Okay, and abstinence from sex. So this is very very not to suffer from HIV infection. Abstinence from the sex is a very best method, but since it is not feasible, so we ask them to use barrier methods, because condom is the barrier method. It's a one type of temporary family planning method that can actually prevent oneself from spreading HIV and sexually transmitted disease. Okay, so this is very important. And monogamous relationship, one faithful partner, okay, should be there, and avoid using shared razors. So there is a habit I've seen in teenagers, like they love to share the razors, and that should be stopped. Okay, because you never know who is suffering from HIV or not, or some may have some kind of infection, okay, in their body. So don't share razors, not even with your siblings, I say. Okay, and needles, syringes should not be used against this. When I was small, these compounders, they used to just heat the needles in the flame, and they used to reuse the needle in the syringe. Okay, but when this HIV epidemic started, then they stopped doing that and they started using this disposable syringes, use and throw. Voila, they just use it for one person for one time and they throw it out. Okay, and women suffering from AIDS or who are at high risk of infection should avoid becoming pregnant. So now this is very very important, since HIV can be transmitted from mother to her baby. It's very important that, if a pregnant if a married person is screened, then and then we find out that married woman is HIV positive, we should ask him to avoid pregnancy. But now what happens when they come to ANC clinic? ANC clinic means antenatal checkup clinic, where the pregnant woman goes for checking their vitals and other things, for the pregnancy related checkup. At that time, when you find out that the pregnant lady is suffering from HIV, so abortion is not the option. Okay, you should ask them to. There are various other options which I'll be. We ask them to go for the elective cesarean section, but we don't advise any abortion, which we'll be talking in the 5th semester. Okay, so it's very important that women suffering from HIV/AIDS or who are at high risk of infection should avoid becoming pregnant. Female sex workers, no, she can't be pregnant. Okay, so I mean, we should educate them not to be pregnant if the female sex workers or male sex workers are HIV positive. If they are not, they can. So second one is prevention of bloodborne HIV transmission. So high risk groups should be urged to refrain from donating blood, body organs, sperm, or other tissues. So someone, a migrant worker, hemophiliac, or female sex worker, they want to donate the blood, then we should ask him. We should stop them. We should urge them to not to do that. Okay, and body or organ donation, they should not do that. And blood should be screened for HIV1 and HIV2 before transmission, which is done routinely. And in our country also, and pre-sterilized disposable syringes and needles should be used, which we use in our country. Standard universal precautions should be adopted. Standard universal precaution means wearing gloves, and using the sterilized disposable syringe. Okay, everything. So that standard universal precaution should be maintained. Yes, did someone call me? So what's the time? It's 4, but I'll finish it, okay? In the next 10 minutes. Because you don't have any other class now. So antiretroviral treatments, so these are only the drugs name you have to remember here. Mechanism of action is not required here. So what are the antiretroviral treatment? Nucleoside reverse transcriptase inhibitors like zidovudine, lamivudine, stavudine, abacavir. Non-nucleoside reverse transcriptase inhibitors like etravirine, efavirenz, nevavirine. Nucleotide reverse transcriptase. So see, nucleoside reverse transcriptase, non-nucleoside reverse transcriptase, and nucleotide reverse transcriptase. So these are actually, tenofovir, emtricitabine. So here in market we have this 2 nucleoside reverse transcriptase and 1 non-nucleoside reverse transcriptase will be combined in one drug. Okay, so to increase the patient compliance. So zidovudine, lamivudine plus efavirenz or nevapirin will be there in one tablet, and this is more commonly used in Nepal to treat HIV patients as recommended by WHO. And what else? Protease inhibitors like indinavir, ritonavir in combined form it is available, and another one is integrase strand transfer in the inhibitors like raltegravir. Okay, so there are other antiretroviral drugs given in micro or pharma, but in COMET, if you can write this much only, it is sufficient. And as I told you, as recommended by WHO, we give 2 NRTIs and plus 1 NNRTI. Lamivudine plus zidovudine plus lamivudine plus nevaripine is given here. Okay, or efavirenz is given. So WHO has revised treatment guidelines in 2013, and what they have said is early initiation of ART at a CD4 count of less or equals to 500 cells per cubic millimeter. So earlier, they used to start antiretroviral drug if the CD4 count is less than 350 cells. But they have said that we will not wait till CD4 count decreases up to 350, but once it reaches 500 cells per cubic millimeter, start ART drug. And starting ART at any CD4 count for people with HIV, with active TB, with hepatitis B vaccine co-infection, with severe chronic liver disease. So person is having HIV plus TB or HIV plus hepatitis B virus or severe chronic liver disease, or if the person is pregnant lady, breastfeeding lady, or young children who are under 5 years of age, irrespective of CD4 count, if it is more than 500 also, start ART. This is according to WHO revised treatment guidelines. So this is how the drugs regimens are decided, for adolescent, pregnant women, HIV TB co-infection, and HIV or HBV co-infection. So basically, zidovudine, lamivudine, and efavirenz or nevirapine is a drug of choice for adults and adolescents. This is the alternative option. For pregnant women also everything same. Just that in case of nevirapine, efavirenz is given. HIV TB co-infection is also similar. HIV HBV co-infection is quite similar. If this is either lamivudine or emtricitabine, okay, or efavirenz or nevirapine. So specific prophylaxis, like if the person is comes with HIV infection with opportunistic infection, then you have to treat the opportunistic infection beside treating the HIV infection. So if the person is having P-carrier pneumocystic carrier infection, you have to treat the person with ART plus antibiotics like trimethoprim plus sulfamethoxazole. It is known as it should be given, and aerosolized pentamidine and dapsone should be given. And for tuberculosis, you have to give the isoniazid drug 300 mg daily for 9 months to 1 year. If the person is suffering from any sarcoma or any kind of cancer, then you have to start the chemotherapy or radiotherapy. And for esophageal candidiasis and other oral candidiasis and other fungal infection, you have to give the antifungal drugs respectively. And primary healthcare AIDS control program should be integrated into country's primary healthcare system. So those persons who are from the urban areas, you will not have this concept of primary healthcare center. We have been teaching you this primary healthcare center from the very first semester, but in every ward, in every municipality, there are PSC, primary health centers, health posts. Okay, so this and then in remote areas, this is the first place of contact where the person comes in contact with the health care providers. So AIDS control program should be included in primary healthcare centers. They can't come to NMC from Rolpa, Rukum. Okay. So for them, we have to have, and this primary healthcare center is available in all the districts. So what should we do? We should make sure that AIDS control program is available in all the primary healthcare centers. Okay, and briefly, occupational post-exposure prophylaxis. So occupational post-exposure prophylaxis means what? If someone gets exposed to the HIV virus, like healthcare personnel, doctors, you and me, while drawing blood from HIV patient, you get prick in your finger. Okay, while operating, you get exposed to the blood of the, you get needle prick, or through any method you get exposed to the virus. Then what happens? Even the refuse collectors who are responsible for collecting all the syringes and all the other instruments of the person, if they get prick, then what? Accidental exposure. Okay, or through unsafe procedures, like you are so confident that you didn't use gloves and you just went to collect the blood of the HIV patient and you get prick. So now you are exposed. Now you are at risk of HIV transmission. So what should you do? First, you should have first aid care. You should clean the wound. Then you should start with this short-term provision of ARVs, antiretroviral drug therapies, for 28 days within 72 hours of exposure to NRTs. Here, lamivudine and zidovudine is only given. Efavirenz or nevirapine is not it. Okay, it's for treating the HIV patient. But for prophylaxis purpose, only lamivudine and zidovudine will be come in a combined form in one tablet, and it should be given within 72 hours of exposure for 28 days. And support and follow-up should be there. Blood testing should be done, and then counseling should be done. That's very, very important. And recently, I mean, in 2014, WHO has recommended to use cotrimoxazole. Cotrimoxazole means this one. Trimethoprim and sulfamethoxazole is cotrimoxazole. So they have started saying that we should give start cotrimoxazole as prophylaxis. Prophylaxis means the person has not developed any infection yet, bacterial, viral, or any infection, but the person might develop. So beforehand we are starting the drug so that the person will not develop that disease. That is prophylaxis. Okay, so HIV related to infection. So before, what they used to do, the person, we used to wait, like the HIV patient is there, we used to wait till the patient develops bacterial infection, then only we used to start the cotrimoxazole. But now the concept has changed. Why to wait? If the person is HIV infected, then we start this cotrimoxazole prophylaxis. But to whom? We have to make sure that adults, including pregnant women, if no recommended for severe advanced HIV clinical disease. So if the person is in WHO clinical stage 3 or 4, start cotrimoxazole. Okay, if CD4 count is less or equal to 50 cell, start cotrimoxazole. Where there is malaria and severe bacterial infections are highly prevalent, start cotrimoxazole irrespective of CD4 count or WHO stage. We will not wait, because these are the condition where in which the person, HIV person, can develop bacterial infection. So just give it. And for children, in case of children, no priority is given to children below 5 years old, regardless of CD4 count. So any child, irrespective of the CD4 count, they give we have to give cotrimoxazole prophylaxis on WHO staging, and to children with severe or advanced HIV clinical disease if they are in stage 3 or 4, or CD4 count is less than 350 also. Okay, if the child is more than 5 years old, these are the criteria. If the child is below 5 years, we start cotrimoxazole. For infants also, HIV exposed infants from 4 to 6 weeks of age and continued until HIV infection has been excluded. See, in infants also, for infants who are exposed, HIV exposed, and exposed to HIV, like if a HIV positive mother gives birth to a baby, then we have to give this cotrimoxazole for 4 to 6 weeks, till 4 to 6 weeks of age. No, from 4 to 6 weeks of age, and continued until HIV infection has been excluded. So we have to give, and after certain time period, we have to screen the blood, and if they are negative, then we stop it. If they turn out to be positive, we continue it. Okay. So TB HIV co-infection, I will not go in detail. I will be talking about this in your 5th semester. But remember that the person who is suffering from HIV has higher chances of acquiring tuberculosis, because tuberculosis bacteria, Mycobacterium tuberculosis, is present in the environment. Okay, because tuberculosis is prevalent in our country, and this bacteria is present in the aerosol around us in the environment. But since our immunity system is so strong that though we inhale them, okay, and they enter our body, we will not develop any signs and symptoms. We will be asymptomatic. They will be in latent phase, but will not develop active disease. Okay, but in case of HIV, they're so weak that once they will easily get infected with the tuberculosis, and the main cause of death could be tuberculosis. Okay, in case of HIV. So how many chances are there? They say the risk of developing TB is estimated to be between 16 to 27 times greater in people living with HIV than among those without HIV infection. Okay, that's a very, very high chances there. So lastly, World AIDS Day. We every year in 1st December we celebrate this World AIDS Day, and it was started in 1988, and we celebrate this day not to enjoy that there are so many people suffering from HIV. We celebrate this kind of day, World TB Day, World AIDS Day, so as to raise awareness among the people, and not only that, to increase to raise fund, to raise money, and to make people aware, and to encourage people, to make them ready to fight prejudice and improve education. Okay, so these are the main motives why on World AIDS Day we talk about lots of information related to AIDS, HIV/AIDS control, and how it is transmitted, what are the causative agents, how we could protect ourselves. Everything is this health education is given through television, through FM, okay, and through distributing pamphlets and brochures. So it's an important way of reminding people that HIV has not gone away, and that there are many things still to be done. And this red ribbon, तिमीले देखेछ होला नि हैन, यो रेड रिबन लाउँछ नि December 1st मा. This is a global symbol for solidarity with HIV positive people and those living with AIDS. Okay, it's a global symbol for solidarity. We are together. To cheer up, to encourage the HIV positive people, we wear that ribbon on that day. Okay, thank you. That's this much for today.